Welcome back to AM Northwest. You know, no one should have to live in pain. Here to tell us how a chiropractor could help ease your discomfort, we welcome back from Pain Relief Partners, nurse practitioner and owner, Stephanie Jones. Good to have you with us.
Thank you.
So tell me a little bit more about a chiropractor. First of all, let's talk about what a chiropractor does.
So chiropractors actually can have a number of different roles. In our case, Dr. Kessinger is a chiropractor at our clinic, and he adjusts the spine and really does that in a very gentle and effective way that helps to treat the nervous system and help with chronic pain issues.
So is there a technique that he uses that's kind of unique to your clinic?
Yeah, he is just doing some training on something called the zone technique that we're really excited about.
The zone technique?
Yeah, so there's 6 different zones that are represented by the spine and the body, and so he can actually feel on the back of the head, and he asks the patient which zone is the most tender or most painful when he touches it, and then that dictates to him where he should treat on the spine.
Wow. What kind of problems are patients coming in with that you've been able to help relieve with this chiropractic care?
So a lot of different problems. Often it's a chronic neck or back pain, and also can be something like sciatica or SI joint dysfunction.
Oh my gosh,
so if
yeah.
someone's hips are kind of tilted off, or there's pain at the lower end of their spine or on their back and causes pain to go down the leg, Tom can definitely help with that.
Oh yeah, because who hasn't had sciatica once you get a little older?
I know.
Wow. Tell me about the ancillary therapies that you have.
Yeah, so Dr. Kessinger works a lot with me doing injection therapies, and then also with our ancillary therapies, and most commonly that would be the non-surgical spinal decompression. So he's able to do a chiropractic adjustment, get them in alignment, and then they're able to lay on a table, and it's a really nice gentle stretch that just pulls the neck and releases, or pulls the lower back and releases, and that allows more fluid into the joint space, and so between the vertebrae, the disc gets more hydrated. So if anyone has a desiccated disc, that means a dehydrated disc,
right,
or has any little bulge or pinched nerve, the decompression table can actually take the pressure off of that, and we've been able to help some patients avoid surgery through treatment with Dr. Kessinger and that decomp table.
Anytime you can avoid surgery, that is huge.
Yes.
So tell me about the injection therapies.
Yes, so that is what I do in the clinic, and we take most major insurances, including Medicare. And you know, as we get older, you mentioned we tend to have more problems like sciatica. So trigger point injections are the main thing that I do in conjunction with Dr. Kessinger, and that's basically identifying a knot or an area of tightness or bound up muscle where a patient, you know, perhaps has had pain for decades and hasn't had any relief, and then I'm able to inject into that area with a local anesthetic. Patient sees Dr. Kessinger and gets adjusted and then does decompression, and it's just a really nice way for them to get a lot of treatment in one place and feel a lot better.
Is chiropractic care covered by insurance?
Yes, it's covered by most major insurances, and a lot of our patients, as I mentioned, are on Medicare, and that typically is about 12 visits a year. It depends on their plan, but that allows them to have just regular maintenance every month and make sure they're in alignment and feeling better.
So let's say someone has a problem. Can someone come to you for a free consultation? How does that all work?
Yes, absolutely. So Dr. Kessinger does all of our consultations. He has been in practice over 10 years. He's board certified, very knowledgeable. And so he will sit down with a patient for 20 to 60 minutes and just really hear about their pain history, what they've tried to feel better, what has been helpful, maybe what hasn't worked in the past, and then come up with a treatment plan with the patient and with myself. So we're all really working together, partnering to help them feel better.
It's got to be wonderful when you see a patient come in with pain and leave pain-free, right?
Yes, yes. We actually had a viewer of yours about a month ago call in, and she had had pain for 30 years and no one had been able to help her. She had tried everything under the sun, and she heard you say, go to Pain Relief Partners, and she did, and she went from an 8 out of 10 to a 0 out of 10 in 2 days. It was amazing.
That is incredible. We want to tell folks, if you'd like to find out more about Pain Relief Partners, you can give them a call, 360-975-4680. We'll put that information for you on our website at katu.com.